Part of the existing agreement Guyana has with the COVAX facility, which is in the process of procuring a COVID-19 vaccine for the country, stipulates that the first set of vaccines will be able to serve 3% of the population. Previously, Minister of Health Dr. Frank Anthony had indicated that the 3% would comprise frontline workers in and outside of the healthcare system. He had stated that subsequent to the 3% supply of vaccines, Guyana is expected to receive an additional tranche which will vaccinate another 17% of the population, which will comprise persons living with cancer, diabetes, HIV, and other conditions that put them at a higher risk of becoming infective with COVID-19. Nonetheless, in Wednesday's COVID-19 update, the minister highlighted a change in the immunization plan, which now outlines that healthcare workers and high-risk persons will be the first to receive the vaccine.
In our context, we are leaning more towards having the elderly and also persons who have comorbidities, because these are the persons more at risk. So yes, we have made some progress in terms of acquiring, because COVAX now is very clear. They have sent us some documentation which we are filling up and sending them back to them.
It is not yet clear which of the vaccines Guyana will receive. However, some of the most popular ones like Pfizer, BioNTech, and Moderna are constantly being touted as the most effective. In fact, the United Kingdom has given emergency approval to the coronavirus vaccine developed by Pfizer, which will start to be administered next week. While Guyana awaits either of the two popular vaccines, systems are being put in place to ensure there's adequate storage and training for healthcare workers,
which include looking at our vaccination sites and improving our cold storage, expanding that cold storage. In some cases, we have to add new storage rooms and things like that. We have also started acquiring the types of freezers that we'll need for the vaccines. So we have been in that process of procurement to get those freezers. And of course, we have to train healthcare staff to be able to administer the vaccine.
The United States drug company's Moderna vaccine has shown a 94.5% effectiveness. This vaccine can be stored in a standard refrigerator with temperatures of 2 to 8 degrees Celsius and for 30 days. On the other hand, the Pfizer vaccine has shown a 90% protection against the virus and has to be stored at a very cold temperature of minus 70 to 80 degrees. The two vaccines are still seeking emergency approval in the United States. Though there are no firm estimated time of arrival for the storage equipment at this point, the ministry is inviting sealed bids for the construction of the upper floor cold storage vaccine bond at Kingston, Georgetown. Temika Rodney reporting for the HGP Nightly News.